eyes and everything like that. So yeah, I think it'll be really interesting. And disclaimer that, like, my qualifications for making this video are that I just took a graduate class in neuroscience. I'm not a professor, I'm not a teacher, so chances are I'll say something that's a little bit incorrect, and that's okay. So don't use this as like the end-all be-all of correct information. It's just meant to be interesting and relaxing. But yeah, let me know if you want to see like an actual cranial nerve exam video, because maybe I could do that and make it like a realistic one based on what I've learned, but this is just going to be a teaching you video. So we will start with the basics, talking about the 12 cranial nerves. Maybe you didn't know that there are actually 12 of them. Yeah, so they are numbered in the order that they exit the cranium, the like your skull, I guess. So they're ordered in the order that they are on your brainstem. So all of the cranial nerves come out of your brainstem, and the first one is the olfactory nerve. I don't know if you can really see this, but number 1 is the olfactory nerve. Number 2 is the optic nerve. Number 3 is the oculomotor nerve. Number 4 is the trochlear nerve. Number 5 is the trigeminal nerve. Number 6 is the abducens nerve. Number 7 is the facial nerve. Number 8 is the vestibulocochlear nerve. Number 9 is the glossopharyngeal nerve. Number 10 is the vagus nerve. Number 11 is the spinal accessory nerve. And number 12 is the hypoglossal nerve. So those are the 12 cranial nerves, and you can see that I wrote sensory, motor, or both, and that basically just means if they carry sensory information like vision and hearing and smell, like that's sensory information, or like when you touch your face. And then motor is movement, like moving, talking, moving your mouth, moving your eyes, is motor. And then both are nerves that are responsible for both sensory and motor functions. So yeah, we are going to be going through the cranial nerves, and we will talk all about them. The only thing is that cranial nerves 3, 7, 9, and 10, so the oculomotor, facial, glossopharyngeal, and vagus, are the 4 nerves that carry what's called parasympathetic fibers. So parasympathetic means like involuntary actions, involuntary things that your body does. So like heart rate is something that's involuntary. You're not thinking about your heart rate right now, your body's just doing it. So those cranial nerves carry autonomic or involuntary processes. Yeah, so we will talk about those as well, but let's get started. So I don't have a visual for the first cranial nerve, the olfactory nerve, but as you can probably imagine, it is responsible for your sense of smell. So it's actually not tested very often when they do a cranial nerve exam. Maybe it should be, but they really don't test it very much. If they are going to test it, they might have you smell like coffee or something like that that's really strong and see if you can smell it. Maybe they'll have you like close one nostril and smell it on either side. But yeah, it's a pretty simple nerve. It just is responsible for smell, so I'm not going to talk too much more about that. But number 2 is the optic nerve. So as you might imagine, it's responsible for your vision, and it is actually pretty complicated. So I printed out this, which shows the like visual pathways of the optic nerve. So everything you see in blue and red is all technically part of the optic nerve. is what's called the optic chiasm, and that is where the two sides meet. So they like cross over at the optic chiasm, and then the fibers continue going to the visual cortex of the brain. And so it's kind of confusing. So this is showing the retina, which I guess sees like light, so that's responsible for your vision, and what's called the nasal hemiretina, so the part that is on the inside, like where your nose is, you know, that part crosses the midline. So like the nasal hemiretina of, which side is this? I guess it's hard for me to see. So this would be like your right eye, and that's your left eye. So the nasal hemiretina, the visual senses that are coming on that side cross over to the other side of the brain at the optic chiasm. But the outside, the temporal hemiretina stays on the same side. Okay, so it's kind of confusing, but essentially what we talk about when we talk about the cranial nerves is like what would happen if you had a lesion at a part of it. So like a tumor or a stroke or a blood clot or something in part of the nerve. So when looking at this, if you have a lesion before the optic chiasm, so before this part, it's going to affect a full eye because it's affecting the fibers that are coming from the full eye. So like if you have a lesion here, you're not going to see anything out of this eye. But then if you have a lesion here, it's only affecting the blue part, which is affecting the outside of this eye and the inside of this eye. So you would essentially only see what is on the right side of your visual field. So like the right side of either eye is what you would see, which is kind of crazy. So there are like a ton of different ways that this can be damaged. There's even like when you get into the brain, like what you see at the top of your visual field is projected on the bottom of your brain. So like if you have a lesion of the bottom part, you won't be able to see what's on the top. It's very confusing. But yeah, it's a lot more than just like not having vision, or you know, it's very confusing, and maybe I didn't need to explain it all, but I think it's kind of cool, and I spent a lot of time trying to figure out like how to understand all of the visual pathways and everything. So yeah, but to test the optic nerve, they would probably do things like having, you know, the chart with the E at the top where you cover one eye and you have to read the chart, or they would do the like tests of peripheral vision and things like this to see like where your vision stops and also where your blind spot is, because you have a blind spot in your vision. So yeah, like testing all the aspects of your vision. Okay, so next we are going to move on to cranial nerves 3, 4, and 6, which all go, this is 5, 6, which all go together because they are the oculomotor nerves, so the nerves that innervate the extraocular muscles. So they all are responsible for making your eyes move all the directions that your eyes can move. So here we have a diagram of an eye. This is a right eye, so like over here would be the nose. Yeah, this is a right eye. And there are 6 muscles that control eye movements. So up here we have the superior rectus. You can kind of tell that like if this muscle is activated, it's going to pull the eye upwards. And then over here we have the lateral rectus, so that pulls the eye out, which is known as abduction. We have the medial rectus towards the nose, which pulls the iris that pulls the eye down. And then we also have the superior oblique that you can't really see back here, and the inferior oblique as well. And most of these muscles are innervated by cranial nerve 3, so controlled by cranial nerve 3, which is the oculomotor nerve, but the one muscle that is controlled by cranial nerve 4 is the superior oblique, and that is the trochlear nerve. And then the one that is controlled by cranial nerve 6 is the lateral rectus, the one that pulls your eye out. And so, again, something you look at when looking at the cranial nerves is like, what would happen if there was an issue with it, if there was a lesion? So, over here, we have normal eye movements. So this person is being told to look straight ahead. Both of their eyes are doing that. That's awesome. Here, this eye is doing just fine. It's looking straight ahead. But this one is going downward and outward. So you have to think of it like the muscles that pull the eye up and in are not working. So what's not working? The superior rectus is not working. The medial rectus is not working. So we're talking about a cranial nerve 3 palsy. It's called a cranial nerve 3 palsy because those muscles are not working and those are controlled by cranial nerve 3. And so you get an eye that faces down and outwards. And if you remember, cranial nerve 3 was one of the ones that we said carries parasympathetic fibers, which are things you can't control. And one of those things is your pupil dilation. Like, it automatically dilates when you're in the dark or light. So if you have a cranial nerve 3 palsy, the pupil will be like permanently dilated. So that's what you would see in addition to the eye going down and out, is you would see the pupil dilated as well. And then here we have a cranial nerve 4 palsy. So if you remember, cranial nerve 4 only innervates the superior oblique. And so the superior oblique pulls the eye down. Oh gosh, I don't remember if it abducts or adducts. It's hard, but you can see that the eye is going up because it's not being pulled down. So that's why you see this eye going up. That's abnormal. And then down here we have a cranial nerve 6 palsy, and this one's pretty easy because cranial nerve 6 just controls the lateral rectus, which pulls the eye out. And so if cranial nerve 6 is injured, then the eye just goes in. It can't look outward, it just goes in. So that's what you're seeing. Here is the eye is just looking inward because this muscle over here is not working. So to test those 3 cranial nerves would probably be something like asking someone to look at your finger and then like moving it outward and watching their eyes like focus on something in the middle and then return to straight forward. Having someone follow like a pen or your finger or something to like watch their eyes move and see if they're moving at the same time in the same way. And then lastly might be like follow the light or look at the light to see if the pupil is dilating properly. Okay, so next we skipped over 5 because 3, 4, and 6 are the ones that control eye movements. So next we're going to talk about number 5 and number 7. So cranial nerve is responsible for the feeling in your forehead, whether that's sensation, pain, temperature, things like that in your forehead. And then the maxillary is like here, you're feeling, and then mandibular is like your jaw, and it also is the feeling in your anterior, the forward 2/3 of your tongue. So that's what this innervates as well. And fun fact, I've got an issue with the mandibular part of my trigeminal nerve because I can't feel the right side of the anterior 2/3 of my tongue. And that is from my wisdom teeth surgery, so this was fun to learn. But yeah, so the feeling in the tongue, and then the one motor part of this nerve, like I said, it's sensory and motor. The motor part is that it controls chewing or mastication. So, yeah, chewing and mastication. So, to test the trigeminal nerve, they would probably just like touch your face with different, maybe like a cotton swab and like a needle, something sharp to touch your face and see if you feel it. They might kind of have you, yeah, like touch your jaw. They might ask if you can chew. They're probably not going to make you chew, but ask if you have had any problems with chewing. But yeah. And then here we have the facial nerve. The facial nerve. It is also sensory and motor. But the facial nerve is kind of like the trigeminal, except that for the sensation of your face, it controls the muscles of the face. So like the muscles of facial movement. And this one actually has 5 branches, and they are the temporal, zygomatic, buccal, marginal, mandibular, and cervical. The 5 branches of the trigeminal or facial nerve. So this controls the muscles of facial movement, and it also controls taste to the front 2/3 of your tongue, just like the trigeminal controls the sensation. And then I also said that cranial nerve 7 was one of the ones that carried parasympathetic fibers, the autonomic, involuntary things. And so the component of that in the facial nerve is tearing, your eyes tearing because you can't really control that, and salivation, so your mouth producing saliva. So yeah, it controls muscles of facial expression, tearing, taste, salivation, a lot of stuff. So to test that one, they're probably not going to test your taste or your salivation or tearing or anything, but they probably would test all the muscles of your face. So have you like puff out your cheeks and scrunch up your face and move your forehead and things like that. And something that can happen that affects the facial nerve is Bell's palsy. I don't know if anyone has ever been affected by Bell's palsy out there, but it essentially just makes one half of your face, like the muscles don't work. You wake up one morning and one half of your face is like drooping, and it's really, really scary because it kind of seems like a stroke. Like that's what you hear of when you hear of a stroke, but it's just a palsy of your 7th cranial nerve that makes half of your face droop, and generally it resolves like in a few weeks or months or something. But yeah, the way to know if it is Bell's palsy or a stroke is actually that Bell's palsy will affect your forehead as well. So if you like scrunch up your forehead and one half doesn't scrunch up, that's Bell's palsy. Whereas if you have a stroke, your forehead would still work, but the rest of your face would droop. So if you ever have a family member that's worried they're having a stroke, do that test. But yeah, so moving on, number 8 is the vestibulocochlear nerve, and I don't think I have a test this, they'd probably test your hearing. They might like make noises on one side and like see if you can hear it, and then make noises on the other, see if you can hear them the same. If they're trying to test your balance, they might have you stand up and close your eyes, because with your eyes closed, they can test if your body is able to balance. Yeah, so that one's kind of simple. Hearing and balance. And then cranial nerve number 9 is the glossopharyngeal nerve. So glosso means like tongue. So it controls your tongue, and this one is both sensory and motor. So it controls the taste in the back part of your tongue. So if you remember, the facial nerve number 7 controls the taste in the front part of your tongue, but the glossopharyngeal is for the back part. It also controls swallowing, and what else does it do? The sensation of the back part of your tongue and your throat. So like the feeling in the back part of your tongue and your throat. Yeah, number 9 is one of the parasympathetic, so I believe the main parasympathetic involuntary component is swallowing. Like, I guess you control swallowing, but on some level you don't. Like, it automatically happens. So yeah, I don't really know how they test this. I guess they could test your taste. They'd probably test your swallowing abilities, like ask if you've had any trouble with swallowing recently. Maybe like have you swallow, drink some water and swallow, something like that. But yeah, so that is cranial nerve number 9, the glossopharyngeal. And then we are going to move on to numbers 10 and 11. So number 10 is shown over on this side, and it is the vagus nerve. Maybe you've heard of the vagus nerve. I feel like I've heard of it, but vagus comes from the root vagabond, which means wanderer. So the vagus nerve essentially wanders all over the body. It does come from the brainstem, but it controls like your whole body, all of your organs in your body, which is kind of crazy. So you can see over here that it controls like like all of your organs of digestion, your reproductive organs, everything. And this one also has a parasympathetic component. So things that you can't control, which makes sense because like you don't control these organs. You don't wake up and think, oh, I hope my liver is working today. Or like, let me control my kidneys, you know. So yeah, it controls all of these things. Yeah, I don't really know what else to say about it. I'm pretty sure the vagus nerve is implicated in your gag reflex and like nausea and vomiting. So my professor, I've never had this experience, let me know if you have, but my professor said that this is why if you get hit in the nuts, if you were born with testicles, if you get hit in the nuts, you get nauseous, and it is because those are innervated by the vagus nerve, and the vagus nerve is like involved in your nausea and gag reflex. So yeah, it also could explain why you might get nauseous when you are on your period and you've got some like ovarian uterus pain. So yeah, I think to test this one they would generally test the last cranial nerve is cranial nerve number 12. Number 12. And it is the hypoglossal nerve. So again, glosso is like tongue. So the hypoglossal just does the movements of your tongue. It's also purely motor, and it's just responsible for you moving your tongue. So yeah, if you see that someone's tongue like deviates to the side, then they might have an issue with the hypoglossal nerve. So they would probably just like have you stick your tongue out to either side, stick it out forward as far as it can go, stuff like that to test your hypoglossal nerve. So yeah, I think it's pretty cool to see, like, first of all, how many nerves